this was the scariest one for me because I kept thinking of the disarticulation of the hip joint. And I kept trying to imagine how do they go in and how do they remove the bad bone and how do they get this piece up in there in such a small incision?
I know.
And they do it with a robot mostly. And then the end of the surgery is kind of manual,
You
but they
know,
do all of the measurements with the robotic device. They make sure everything is exact. And then they put this big porcelain thing up. They put a plastic kind of, I don't know if it's, they put something in the hip pelvis area and then the ceramic thing and then another plastic rubber thing. And then the titanium is attached to that.
yeah, it's kind of
So if it's on that.
that's amazing. What made you feel less afraid knowing that you were going into the unknown of this surgery?
I looked at the success rate of the surgeon, how many infections he's had, how successful he's been. I looked at all of the remarks that patients had made about
Yeah,
him and about the center he was
makes a
in,
difference, doesn't it?
and that made a big difference. He's very good. He calls every patient the day afterwards
Yep.
and speaks to you verbally, and he still calls me and says, "You doing okay?"